of the discussion, I'll be dealing with autism. So autism, it has been also known by another name nowadays, that it has been called as autism spectrum disorder. Spectrum means it is going to have myriads and varies myriads forms of clinical features. It is just not one. It cannot be defined by just a single entity or a single clinical feature. So nowadays it's a spectrum. It is called as the spectrum disorder, just because it is going to have varied number of clinical features, and it has got very various clinical presentations as well. So it was firstly, how to define it. It was Kramer who described autism as a clinical syndrome in children with inability to relate appropriately to peoples and situation. So it was Kramer who defined that autistic children, they are going to find very difficult, they are going to, okay, hello. They are going to relate, they are unable to appropriately relate to the people and to the situations as well. So it is a kind of a child, good afternoon. So it is a child feels very much difficulty in relating to the people and to situations. He behaves in an inappropriate manner. Now, looking at how do we define it as, so it is the autism, it has been collective, it is a collective term which is given to the developmental disabilities that impair the way individuals interacts with and communicates with others. So basically it is an impairment disorder where certain areas, because it is a neurodevelopmental disorder, so just because of certain neurological problems, there is a deficit of neurodevelopmental process, so that is ultimately going to impair the individual's ability. Okay, I'll take the Berger's disease as well. So the patient is going to, it is going to affect impair the individual's ability to interact with and communicate with others. Now, so since autism spectrum disorder, it is consisting of, it has got 5 subtypes. So there are 5 subtypes of it, because it is a spectrum, it is a syndrome, it is just not one presence of one single, okay, single clinical feature. So it is going to have a number of clinical features altogether. That's why it has been called as a spectrum disorder or a syndrome, and it is going to have 5 subtypes. So 5 subtypes, depending upon, it has been also called as the autism disorder, and it has been the 5 types what are related to it is, that is the Asperger's syndrome, the Rett's disorder, the childhood disintegrative disorder, and depending upon the presence of certain clinical features, certain traits in one or the other, these have been divided into these 5 subtypes. Now moving on to that Itard, it was firstly in the year 1801, it was Itard who described an autistic child to be a violent child with no language. Now he said that such a child is going to have no language skills. The skills, the communication skills, the language skills, they are absolutely absent in such a child, and it has been found that these autistic children, their development of the motor skills, their development of the motor speech skills, it takes place a very long time. Initially, the children are unable to respond appropriately to the questions what are being asked to them. So similarly, it was Itard who found that such children are very violent or aggressive, and they are lacking the language skills as to how they are going to communicate with the outside world. And these skills are lacking, and these children are going to assume other people to be as objects, because they cannot understand the feelings what the society, what the people around him are trying to convey. Sometimes he is just, the child can have a blank facial expression. He is unable to get what the other person is demanding, what the other person is having, the psychological, the sentiments, the emotions. He is totally unaware of the other person's perspective who is there along with him. So it is related to that these children, they assume other individuals to be just as mere objects. They will consider other people to be just mere objects. They are totally disconnected from the feelings exhibited by such people, the people around him. So Bleuler, he also he also defined these autistic children, that he used the expression autism for a who child to assign the loss of contact with the reality. The child assumes himself that he is from a different world. He is an alien in the surrounding. So he has loss of contact with the reality, and that was caused by a difficulty or impossibility of communication. So the child is always trying to be aloof. A child is always trying to be lonely, engrossed in his own things, engrossed within a particular task, continuously repeating certain words, undeliberate, without any motto. He can keep on swinging his arms, legs, he can keep on shaking his hand, shaking his legs, shaking his body, so this rocking his body. So such children are totally engrossed in their own worlds, and they are totally aloof from the society. They don't want to interact with people, they don't want to mix up with people. They are absolutely lacking the social skills what are needed at that particular age group, and this, once it has been acquired in a child, that persists throughout life. Usually the motor speech development takes a very long time in the autistic children. So autism can be defined as a pervasive developmental disorder in which it is a syndrome which is consisting of an abnormal development of social skills. The child is going to lack, the child is having deficit of the social skills, as well as these lacking of social skills can be either in the form of withdrawal. So the child tries to run away from the society, or the child tries to, is not interested in mixing with the society, he tries to remain aloof. So he has such a condition is called as the withdrawal from the society, and as well as he lacks interest in peers. He has as such no friends. He has no interest in communication with other children of his or her age group. So there's going to lack interest in peers, and that too, which is accompanied by limitations in the use of interactive language. So the child is not going to express him or herself in the feelings of love, anger, whatever feelings, the feelings he is having, he is unable to convey, he is unable to express his feelings. All the more, he is least expressive. He cannot express his thoughts and feelings. So that is being defined it as that the limitations in the use of interactive language. There is complete absence of an interactive language, and these interactive language can be either in the form of speech as well as non-verbal communication. So there are certain non-verbal communication. When a mother tries to pick up a child, the child is going to throw his or her arms to the mother. He wants to get into the lap of his mother. But autistic children, even if the mother is showing her arms to the baby, the child is not going to respond to it. Or if a parent is standing in a with a frown and folded hands in front of his child, the child is absolutely unaware of what feeling the other person is having in front of him. So he's absolutely having loss of contact from the society, loss of contact from the social people around him, as well as there is limitations of the interactive verbal language as well as the non-verbal language. He is unable to convey. All right. And there are sensory motor deficits as well. So these sensory motor deficits may be in the form of that is there is inconsistent response to environmental stimuli. So the environmental stimuli, as appropriately it should be in accordance with the environmental stimuli, the response should be there. But since there is a deficit of sensory motor deficits are there, so the child is not going to appropriately respond to the environmental stimuli. Now, looking at the etiology, what are the causes? So nowadays, it has been a matter of great research that as to what are the genes what are being located on a particular chromosome which makes a child autistic. So there has been genetic predisposition, it has been found, and genes are have been held responsible for such an autistic child, and it has been found that it is having a familial origin, because it has been found that 3 to 8% of the chances are there in a family of having an autistic child born who are going to have an autistic child previously in the family. So there is an increased incidence that autism, it runs in families. So there is an increased chance of having 3 to 8% of chances in the upcoming children if a child in the family has been autistic previously. So this is the genetic predisposition for it. Next, there are certain syndromes such as the Fragile X syndrome and the Rett syndrome, where it can be related to one of the etiology of this autism, whereas certain medical conditions such as the tuberous sclerosis complex, there are certain prenatal factors that during the intrauterine life, if the mother is getting the rubella and the cytomegalovirus infection is there. So this kind of a prenatal infection that is going to impair the neurological development within the brain, and that can lead to the development of an autistic child. Whereas in the postnatal factors, if after birth, if the child is going to have suffering from encephalitis or untreated phenylketonuria or having herpes simplex virus infection, so these are certain postnatal factors which have been held responsible for causing autism. Apart from that, nowadays, since genes are being extensively studied, they are under research as to what are the genes, what are the location of certain genes on what chromosomes they are located in an autistic child. So it has been found that genes what are located on the chromosome number 2, 7, 15 and 19 have been suggested, and there is greater predisposition of having a males towards autism as compared to females. Means males are more affected as compared to females. So there is a possibility, there is a probability of having it is seen mostly in boys as compared to girls. So it is an X-linked disorder, and now the recent studies have also evolved that nowadays there is late parenting. So at the age of 40, the father's age has been held responsible for causing autism. It has been found in recent research studies that the elderly males, that is above 40, if a father is going to have children if a person is becoming father after the age of 40, then there is an increased chance that the child might suffer from autism as compared to those who are becoming father at the age of 30 years. So if it is earlier than 30 years of age, if a person is becoming a father below 30 years of age, there has been found a decreased incidence of having an autistic child. But in the elderly males who become father after the age of 40, that increases the chances of having a child developing autism or to be born with an autistic deficit. So autism. So this has been found. So parents who are above the 40 years of age, the fathers who are above 40 years of age, it has been found in recent studies that there is a probability, there is an incidence that their children might show autistic features. So now looking at the clinical features, so what are the special clinical features as to how we can recognize these children from the normal children? So they can be broadly subdivided into 3 categories. Firstly, it is the social interaction, next is the communication, and third it is the behavior. So in the social interaction, what we find is that in normal children, what do we find is that they have that confidence, they want that during a conversation, normal children, they'll be going to have an eye contact. Whereas in an autistic child, the child is lacking maintaining a stable eye contact while dealing with people. So he does not, he's showing deficit in eye contact. He doesn't want to make eye contacts. He's totally afraid of facing the strangers. He is not at all interested, not at all willing to meet or see any strangers. He's completely engrossed with his or her own toys and gifts, whatever he's playing around. He is least interactive with the social environment. So, and that too, sometimes the facial expression is all blank. Such children, the autistic child may have a blank expression, whether it be happiness, whether it be sorrow, in any condition, abruptly in an atmosphere, they are not going to relate as to what all is going on around him. He can cry in a very happy atmosphere, he can start laughing in a sorrowful atmosphere. So the child is going to behave inappropriately in social environmental conditions. So sometimes the expression of that child becomes absolutely blank, facial expressions are there. The body posture is somewhat he or she might keep on shaking and shagging his legs and feet. So these all things are there. The emotional signals, the child is unable to react or relate or to understand the emotional signals what are being shown to him. So these emotional signals, they are absolutely lacking within the child, and such children, they feel like playing alone. They are mostly very introvert, they don't talk much, and if the cognitive development of speech is going to develop, that is going to occur at a later stage of life. So such children, they are solo, their tuning and understanding with others is very limited, very minimal, and sometimes the parental touch that parents they pat or they touch their child, so that such children become very much apprehensive, they don't feel comforted by the touch of their parents even. What about strangers? They're not going to face the strangers, but even if their parents are going to fondle them, they're going to pat them. Thus, these children, they feel very much uncomfortable when they are being touched. Now, looking at the communication, since both verbal and non-verbal communications are deficit in an autistic child, so there can be delay or absolute lack of talk. The parents keep on repeating the same things 10 times, 15 times, the same question, and the child is not going to respond. So such is a feature of an autistic child. There is a lack of talk, and the two-way conversation. Whenever there is a talk, there has to be a both-sided conversation. So it has been found that these children, they are lacking the taking turns perspective. Means if a person has been completely has said his or her thing, the autistic child is not going to revert back in an appropriate fashion. He needs to be the person talking to him needs to be constantly saying a word, and there is a possibility that the child is not going to respond. So all right, so these taking turns, and in certain children it has been found that if they got stuck with a particular phrase, if some phrase got clicked into their brain and if they uttered it, so they'll keep on uselessly, repetitively, in a nonsense manner, they'll keep on repeating the same phrase over and over again. So such a kind of a repetitive phrase these children can utter, and the technical term for this such kind of a repetitive, meaningless phrases, this has been referred to in the medical terminology as echolalia. And as I've already said, that these children are lacking the perspective. They have a deficit in understanding the listener's perspective. So whosoever is speaking in front of him, whosoever is talking to him, to whomsoever they are trying to say anything, they are absolutely unaware. They are not at all interested in the listener's perspective on what behalf the other person is talking to them. He's having lack of humor. He might not feel amused at the things what normal children might get amused. And the child is more or less focused, self-centered on himself. There is a non-verbal communication using interplay of non-verbal clues. So he's unable to get as to if a mother is standing in front of him with his arms open, getting the child come to him, waiting for her child to come to her. So the child is going to have a blank expression. The child may not show the non-verbal clues that he also wants to get into the lap of his mother. So this kind of a interpreting of non-verbal clues, the child is unable to make out. Moving on to the behavior patterns. So it has been found in autistic children that such children, they are having such a low IQ that they are unable to focus on certain things, or if they are focused at a particular thing, they'll keep on focusing on that particular thing for a much extended period of time. For example, if they see a car, and supposedly if their eyes got struck on the wheel of a car, So they'll keep on looking, staring constantly and engrossed within the wheel of that car. If they are shown a piece of a shirt with buttons on it, and if the button is quite sparkling or glittering, so the child's focus might happen that an autistic child may just focus on that particular shining, glittering button, and he's not going to admire, he's not going to appreciate what shirt is lying there. If it is stuck, if his attention, if his focus is there on that particular button or the piece of uh, shining strip or shining strands, so he might be completely engrossed on for an extended period of time on that particular button or on that particular string which is shining. So this has been called as the focus on parts or pieces. So as the child is constantly observing a part of a particular device. For example, in case of a car, he's observing the wheel. In case of a shirt, he's observing just a single button over there. So the child is focusing where? He's just focusing on a part of a thing, particular thing, and not the entire thing as a whole. So there is focus on parts or pieces. He's just going to focus on a particular thing, thereby excluding the totality of that particular object. He's not going to appreciate. He'll be stuck, his focus will be stuck on that particular thing, what his mind has taken. Now, similarly, and these children, they are also going to show the need for sameness or routine. Means if such autistic children, if they are in the habit of following a particular routine, they're getting up early in the morning and they want a particular toy. So that particular toy should be there along with him throughout the day. He can keep on playing with the toy throughout the full day long and he'll be totally satisfied. If an autistic child, for example, he's taking a particular path towards a school. If there is a road, what is leading to his school? So if one direction, one pathway, he has known that this way I need to follow to get to the school, he wants the same routine to be followed throughout. Whensoever he wants to go to a school, he wants the same routine to be followed to reach the school. He wants the same paths to be followed to reach the school. So that is, these autistic children, they show that there is the need for sameness or the same routines. It has been found. And these children are very much preoccupied with certain toys or certain activities. So if they are having an affection towards a particular toy, they may keep on clinging, they can keep on holding that particular toy within his or her arms and they can spend the whole day. Similarly, if they are afraid towards a particular thing, they might not feel like looking at or having any interest towards a thing what they absolutely dislike. So both the kinds of things they have been found, and it has been also found that the phenomena of twiddling, that is holding on something in hands and constantly observing it for hours on end. So this kind of a twiddling something and flapping of arms and legs or both, this has been found mostly, and that it has been found that these children, they show certain hypersensitivity reactions as well to certain kinds of food and certain kind of textiles. Certain pieces of cloth, certain allergies, they may show hypersensitivity reaction to certain kinds of foodstuffs and textiles. Now, the most important fact what I need to emphasize over here, that either in case of an autistic child, it has been found that the child's IQ is totally low. That has been found that in certain children of who are having this autistic disorder, either their IQ may be very, very low, or they can be gifted. Gifted in a sense that these are extraordinary children who are very precise and very sharp in focusing on certain things. You must have seen certain children, if they are giving a world map or something of whatever map if you give them, and they are going to locate, pinpoint a particular, this place is this place is this on map, this is this state, this place is this. So they are going to precisely allocate those places, which an ordinary child is unable to do. So either these children are having a very low IQ, or they are blessed, or they are gifted with certain unusual skills, such as remembering certain dates, remembering certain places on the map. So they have savant skills. Savant skills include that they are going to precisely, sharply remember certain lists, certain days, certain places on the map, which an ordinary child cannot. So either their IQ is very low, or they are absolutely gifted children, which normal children cannot memorize. They are very sharp at memorizing certain things. So, and apart from them, what do you find is that these children, they show features of both anxiety as well as depression, and they are lacking sometimes it has been found that they lack the normal sleeping pattern. So there is sleeping problems as well, which are seen in an autistic child. When it comes to developing social relationships, so now in cases of social relationships, it has been found that either these children are going to absolutely lack the friendship, they are not going to mix up with other children, and if in some or the other condition, if they are going to mix up with children also, they are not going to endure that relationship of friendship. The friendship relationship shall not last longer, just because these children, they might keep on playing and playing, and they might hit the other child. So that is ultimately going to make the other child stay away from him. So these children are totally aloof. Either they don't feel like being in friends, or the children of their own age. But if they are getting into friendship as well, these children, they are unable to maintain a longer friendship bond, because they will act in a very inappropriate way that the other child may not take it for granted. So this kind of a social relationships that children are lacking, and if this condition is there in a particular child, and it has been diagnosed in childhood, that is going to continue throughout the life. So students, this was a very short discussion about autism. If you do have any queries or comments, you are most welcome to comment me in the comment section. And students, if there are certain topics that you want to be discussed by me, you are most welcome to comment me in the comment section. Thank you for watching.